persistent headache you are ignoring might just be what we need to know what's wrong with you. Welcome to the Learn With Me series, brought to you by Set 18 Oncology Nurses in Training, National Hospital, Abuja, Nigeria. In case you're just joining us for the first time, this is the Preventive Health and Wellness Hall. Today we will be talking about the signs and symptoms of cancer. And in professionalism, experience, they say, is the best teacher. And those who have walked through experience can confidently take others through it. That is why we have brought to the hall someone with over 18 years of experience in nursing, no other person but Nurse Emanuela. Nurse Emanuela, you're welcome to the hall.
Thank you.
Thank you for joining us, and I'd like you to introduce yourself to the public.
Okay. Nurse Emanuela Igbafe, registered nurse, registered midwife, registered perioperative nurse, registered public health nurse, BNSC holder, and oncology nursing in view.
Oh my God, did you listen to that? Ready. We're going to talk about that another day. So today, when I thought about the signs and symptoms of cancer, I had to think of someone who has worked in the oncology space for a while and who has got experience before, because a lot of people would say, oh, I have headache. We have the differential diagnosis, one sign or one symptom giving a different diagnosis. So that was why I thought of you coming to talk to us, and thank you so much for honoring the invitation. So we've had several people come define cancer, but I'd like to get it from your own point of view, what you feel or think cancer is. It could be scientific, it could be your own broken down definition of what cancer is.
Cancer is a malignant disease that can start from any part of the body and multiply rapidly, spreads to different organs of the body. It may just be in normal cells that just decides to say, okay, I want to be cancerous, I want to be malignant, and then, from there, boom, starts spreading, goes like that, without any control and all of that.
Well, anyway, if that is cancer, today our main topic is on the signs and symptoms of cancer. So before we go to that, what are signs, what are symptoms, so that people will be able to understand what we're talking about?
Signs basically is what can be seen, measured, and felt. While symptoms, it's what the patient tells you it is. For instance, example of signs, number one, you have bleeding, we have blood pressure, we have fever. Then for symptoms, we have pain, we have fatigue, weakness, dizziness.
So that is what the person feels.
That's what the person tells you. Yes, that's symptom.
Then what we as health professionals can measure is the signs. Okay. So what are now the signs and symptoms of cancer? What can somebody see or feel and say, I need to go get checked? What are they?
Okay. Number one, unexplained weight loss.
Okay.
We have number two, bleeding. Number three, we have coarseness of voice, headache, persistent headache. Then we'll talk about you have an injury that doesn't get healed, regardless of your medication, your lifestyle modification, and all of that. So those are some basic signs of, you see the headache there, it's symptom. It's what the patient is telling you, I'm having headache. I'm always feeling very weak. I'm having fatigue. So those are the symptoms. Why the sign now, you're seeing the patient bleeding, fever, then you're seeing a physical lump or sore, injury that is not, it's not only when patients have diabetes that you say, okay, this person, okay, I guess it's diabetes, like you mentioned, differential. So, but when the patient is having cancer, it may just be a red sign, a red flag that, okay, this person should be more evaluated.
Talking about the signs and symptoms of cancer, I would like us to take it one after the other. You talked about unexplained weight loss. You mentioned something like that. So what do we see about unexplained weight loss in regards to cancer?
Unexplained weight loss is simply a very huge gap between your previous weight and your current weight.
Okay.
Take for instance, you're somebody that weighs 70 kg on the normal, then all of a sudden you're weighing 50 kg or 60 kg. That's a whole lot of difference between your previously weight and the recent one. So this is not just about you're going through stress or you're on a special diet regimen. So with this difference, that is something to worry about. So that is why it is termed unexplained weight loss. Maybe you may not even be going through, in fact, I don't see the stress that will make you lose a whole 20 kg. That's a whole lot, yes. So that is one, in fact, one of the key, yes. And most of our cancer patients always confirm this.
So what type of cancer would one assume to is associated with unexplained weight loss?
Practically almost all cancers.
Almost all cancers.
Yes.
So that is something to think about. So when you're having unexplained weight loss, you are expected to go for the check. You also talked about a sore that does not heal. What do you mean? Diabetic wounds don't heal. So how do I know the difference between a cancerous wound or a lesion and a diabetic wound? When you say a sore that doesn't heal, and you talk about a swelling or a sore on the hand or any part of the body.
Okay. To be specific, if for instance you are having a breast lump or a lump in the skin, because it's not only breast cancer that has lump, even in the skin you can just have a lump there. Well, you see the difference is diabetic wounds that don't heal, it comes with this kind of smell.
The characteristic smell.
Yes, the characteristic smell. Then diabetic wound does not have lump or seed.
Okay.
But you see for cancer, it has this kind of lump that is not even well defined.
Okay.
And it can increase over time.
Okay. So the signs are irregular.
Yes.
And has a tendency to increase over time.
Yes.
Okay. You also mentioned bleeding as a sign and an early sign of cancer. What would you say about bleeding with regards to cancer?
Bleeding is another early sign of cancer because one, if you're having bleeding after your menses, that is a sign. So you shouldn't ignore such. You have to go for further evaluation. Then, for women who are past menopause and all of a sudden, boom, you're seeing menses again or bleeding, that is another sign that you have to watch out for. Like I had a patient in the past that she has passed menopause for like 10 years. And all of a sudden, she started seeing her menses again according to her. And when she called me, I told her, that's not menses. That's already a problem that we need to dig deep into and to know what is the problem. And so she was like, no, it's God answering her prayer to have a retirement baby.
As they always say.
So I had to encourage her and persuade her because it's not always very easy. Especially when they already have their mind made up that this is God answering them. So we went to the hospital. After much evaluation, it was discovered she had stage 1 cervical cancer. And the joy of it is this woman is still alive till date.
Wow.
Because why? She was able to, voice out and
she listened
to my advice and she followed the treatment regimen to the end. Today she's still alive.
Oh, that's a beautiful story to hear. And I'm impressed. So now you also mentioned persistent headache. Now in a country like Nigeria where we suffer every day and you cannot differentiate between stress headache and illness headache, how do we know what persistent headache is telling us that this is cancer? How do we differentiate? Headache is headache.
Headache is headache, true.
Yes.
But you see, this particular one, by the time it starts affecting your vision, you start having blurring vision, you start feeling dizzy, at the point of you having seizure, sometimes you start throwing up. That's not just an ordinary headache. So you have to go for more evaluation. Because when there is a tumor in any part of your brain, it can lead to all of this. So when you go for checkup, maybe doing an MRI scan, a brain scan, you can just spot out where that particular tumor is found. And with that, you can, overcome it early. Because why? Early detection is key.
Early detection, that is what we always advocate in oncologists. Now, you mentioned something that is not very, people think it's not very significant. Talking about hoarseness of voice and coughing. Now because I no chop ginger, now make a cough. Or now because now make a cough. No, be serious cough. So not just simple cough. So talking about coughing and hoarseness of voice as a sign of cancer, how do we explain that to the public to understand that this is a clear sign you need to go for a check?
Okay, coughing is actually a sign of so many illnesses.
Yeah.
Like if you are coughing for more than 2 weeks, they tell you go and do tuberculosis checkup to be sure that you're not having tuberculosis and all of that. But you see with cancer, it's very, very distinct. Because at a point, you may be, especially when there is that growth in that your... Yes. You even if you take drugs, like you go and do TB test, it will show negative. Then you go for sputum and whatever. But as far as all those tests are showing you that it is negative, so you should now know that this is no longer the regular cough. So it's very, at that point, you need to go further to check and know why. Some come to the hospital and say, they even say I get TB because of the cough. I don't go do the TB test, it don't show anything. I don't take antibiotics, resolve. I don't take agbo, I don't take different concussion, stuff. So once you start hearing that, your mind start thinking that, oh,
malignancy is somewhere.
it's already playing out somewhere.
Okay, and will be in regards to the respiratory system.
Yes.
With the lungs or the
bronchi. Yeah.
Okay. So you have just spoken about the respiratory system. Now going further to the digestive system, that's really, really good. One of the signs that we were taught in class was the irregular bowel movement. People, especially people who have diagnosed themselves and say they have ulcer, they'll tell you, my ulcer, and they do me. People have their own beliefs. So how do you tell somebody that this your irregular bowel movement is not your ulcer? And ulcer does not belong to anybody. It is not ulcer that is causing. How do we differentiate between the irregular bowel movement of other digestive issues and a malignant issue?
Okay. The gospel truth is, and when you have successfully ruled out you're not having ulcer, you're not having diarrhea, maybe because of food or water that you ingest. So the next thing you should be looking at is, okay, let me go further to do colonoscopy. Okay. When you do that, it will show, in fact, the picture will be very glaring if the person is already coming down with colon cancer or whatever. So that's why, whatever is the symptoms or sign you're having, always speak out. Tell somebody, especially that is within the space of this oncology practice, so that they will help you to navigate properly and make a very concrete decision and prompt treatment.
See, that is why we have the preventive doctor practice. In the hall, you get the right information from the right professionals. When you have been able to see this is not a problem, go to the right professionals, get the right information, do the right testing, and I'm very hopeful that early diagnosis will give us good prognosis. But are there any other signs of cancer that you would like to share? Is there any specific one we haven't talked about that you would like the public to take note of?
Yes, there are other signs like lump in the breast.
Okay.
That's very common. In fact, most girls will just say, I used to have a seed in the breast, but that's not a normal thing. And now there are differences between breast lump. Some can be benign, some can be malignant. So once you go for this normal breast examination, you can even do your self-breast examination. If you notice that you're having this kind of particular sign, and most times benign lump are usually painful. Take note. Or for malignant one, it's usually not painful. It's painless. So that's even why they most times come down with stage 3, stage 4. Because it's not painful, they will feel all is well. But you see that particular one that is painful, may not just be anything. So whether it's painful or not, it's always advised that you should come to the hospital or meet any professional that can help you distinguish between the normal breast lump and abnormal breast lump. Then we also have, for the men, we also have these symptoms of, okay, you want to urinate, you're not able to urinate, then maybe you urinate more often at night, or you're having painful urination, or you have burning sensation when you want to urinate. In fact, you should come to meet a professional so that they can quickly do some investigation like the PSA.
What are your last words to people out there about cancer?
Okay, my last word for people out there is, cancer is not a death sentence, and it's not something that anybody pray or wish for. But it is very important that you speak out. Whatever sign you're having, whatever symptoms that it's presenting, always speak out to the right person so that they can be able to guide you through and make you, because if you don't speak out and you are ashamed or you are shy,
yes.
And there's this popular saying, sickness now say, hide me, make I kill you. So when you speak out, you get good answers, especially when you talk to the right person. So you get good answers, you get good advice that will probably lead you to prompt treatment. Because like I said, early detection is key.
Yes.
So if you voice out on time, you'll be able to get the necessary help that you need, instead of staying quiet and allow the cancer cells to now, metastasize, spread through the body, which would have been nipped to the bud if only you had voiced out on time.
Are there any of these signs you have seen and ignored before? Please let us know in the comment section. Is any of the family member, friends, relative, loved ones having any of this sign or symptom? Please drop in the comment section so we can follow up. If you have further questions, please drop in the comment section and we will definitely attend to each and every one of them. I am Patience Ibasa Achichi. Thank you for joining us. We look forward to seeing you some other time every Monday and Thursday. I hope you've learned something new today, and I hope you've learned something new in our next video.